parents, are currently faced with two competing realities: the need to educate our children and the existence of the pandemic and the need to protect the public's and our children's health and safety. And I think we all know this, and that it's a complex challenge, a very complex challenge. You know, we know the benefits of in-person instruction as parents, as former educators, as people who work for school systems. As a former teacher, as many of you know, I know what it means to be able to look at that child when the light goes off and they understand the material, or when there's a look of confusion. We also know that for parents, it's very, very difficult, very difficult. Some parents who have the benefit of working at home are trying to do their job as well as help their children. And then people with jobs outside of the home who are frontline workers have to address the issue of childcare and support and helping children while they're trying to learn. You know, we've seen kindergarten students being placed in front of screens when they have other tasks and challenges to learn besides sounds, colors, and letters, moving around and keeping decorum. I spoke with a high school math teacher in one of our counties who said, you know, she's talking to names on a screen because in many cases they don't even have their visuals up, their video up. So there's very difficult challenges in terms of assessing learning, effectiveness, and I think we all acknowledge that we're falling far short of normal course standards. At the same time this is happening, there's been little statewide coordination, leaving much to the local superintendents who we'll be hearing from in just a few minutes. We saw about 6 or 8 weeks ago that the governor and the state superintendent provided 2 metrics to help open schools. But when they were announced, every jurisdiction in the state had already met those 2 metrics. So it offered and provided little leadership and direction. Beyond that, there have been no steps, statewide steps, to give us clarity in how to reopen in our 24 jurisdictions. Local superintendents, in many cases, have been left on their own to figure out how to reopen, how to deal with the health issues, how to deal with the resource issue. You know, just a couple of weeks ago, it was decided that fall sports would begin, including contact football. And that was done without any testing regimens in place or resources to test these young people every week or twice a week or every 2 weeks. And we know with football, for example, they're in close proximity with huddles, they're in locker rooms, so we don't know what's going to happen. You know, the professional basketball has worked in a bubble. They tested people every day and they had no cases. College football, many games have been deferred. 10, 15, 18 people have come down with the pandemic, with Corona-19. But it's unclear what kind of support we're getting from the state administration and the state Department of Education on these kind of activities and the resources to make sure our children remain safe. There's $10 million in CARES money from the federal government that's been offered by the governor to those systems that can open up. But it was brought to my attention that it was announced 3 weeks ago, Fairfax County in Virginia, one county, spent $4 million alone for upgrading their county's HVAC air handling system. So it's unlikely that the $10 million offered will go very far, particularly across 24 jurisdictions. So that leads to the question of the day: how do we return children and retain safety precautions? And again, it's not an easy answer. In New York City schools, they've decided when 2 different people in 2 different classrooms come down with a virus, a school building will close. In Iowa, on the other hand, schools must conduct half of their classes in person unless 15% of all tests in the community are positive, or 10% of the students call in sick. Well, this is far beyond the 5% thresholds that many states are using across the country. The Des Moines superintendent originally defied the order from the governor and went to court and held classes online. Since then, the local Board of Education in Des Moines, as a compromise, has shifted to a hybrid model. We've read some of the articles about Florida and Georgia, where even after outbreaks of dozens of students, schools have remained open. And back to New York for a second, they provide daily report of schools and outbreaks. And today, positivity tests among students have been very low. They reported recently that of 37,000 staff members tested, less than 0.5% tested positive. And they are trying to develop a regimen where 10 or 20% of the students are tested each month. So it's very different across the country. So the question becomes, how will it be handled in Maryland? I'm sure many of you saw the news a couple of days ago where Caroline County experienced 2 schools with outbreaks, one with 8 staff members testing positive. It's complicated, it's complex, there are no simple answers. But let me conclude with this. The health director in La Crosse, Wisconsin stated, in a time like COVID-19, for us to be working on creating guidance materials at the same time when it should be coordinated has been really frustrating. So that leads us to today. We have 4 local superintendents, 2 health and facility experts, and 3 stakeholders to discuss a number of things. For the superintendents, we've asked them to cover their plans for returning to in-person instruction, if cohesion across the state exists or is needed, and also to share their biggest challenges. And finally, in the longer term, beyond 5 or 6 months, can they suggest any strategies for mitigating the learning loss? We'll be going back in January, and we're going to have to address these issues. For the health and facilities experts, we've asked them to speak about what is needed to return safely and back-end protocols in case of outbreaks. And finally, to the stakeholders, teachers and parents, we want them to talk about their willingness to return to work or sending their children in under work circumstances. We'll let each panel present, and we'll hold questions till they're all done their presentation. So with that, let's go to the superintendent's panel. I'm not sure what order we're proceeding, but let's start with our 4 superintendents.
Good afternoon, Senator Pinsky and members of the committee. Each of the 4 of us will very briefly share specifics to our systems, and then each of the four of us will respond to the overarching questions that you were just laying out. And so we have our lesson plan ready today, and we'll just proceed quickly. First of all, in Montgomery County, I'm Jack Smith from Montgomery County Public Schools. We have a board resolution of August 25th after a summer's worth of work that calls for us to come back to the board at the end of first marking period, the first week of November, with recommendations, with updates, and with a plan on how we could potentially bring students back into school second semester in a model that would adhere to all of the requirements around social distancing, appropriate equipment, sanitizing, transportation, all of those areas. The resolution also allows for the ongoing conversation around appointment or event-based opportunities like giving the SAT, doing special education assessments, those sorts of things. And some of those we have begun and some we're working to begin in the coming days. We also are looking at how that transition might go during the month of January as we gear up, starting small and then moving towards serving many, many more students as second semester begins. When we do come back into place, we've put a lot of safety precautions in place. Our buildings are already actively used every day by teachers who are choosing whether or not they want to teach from their own classroom, by our building services staff who maintain and keep the building appropriately cleaned, our administrators, and our food service and materials distribution. So a lot of that's already in place. We have set forth health and safety practices across the schools, daily health attestation for staff and students, required face coverings, limiting building access to just students and staff, hand sanitizing stations, hand washing encouragement, training on prevention for students and staff, signage and reinforcement with regard to social distancing, and providing ongoing support for all of our school administrators, teachers, and support staff. In terms of social distancing, We're continuing to give training and provide materials so that we live within the requirements that are so necessary to stop the spread and prevent the spread. Personal safety, we have created kits that have masks, gloves, hand sanitizers, wipes, all delivered to our support staff in our schools. We'll deliver those to students upon entering the building, and we have replenishment. We have spent a lot of money, as I'll talk about in a minute, on that. Furthermore, in certain circumstances, goggles, face shields, transparent face coverings, gowns are important, and we've procured all of those. When we talk about the funds to ensure these safety measures, in Montgomery County, we've spent about $11 million on that equipment so far, and ventilation upgrades over the past 6 months. We currently have a $7 million request in front of our county council for additional ventilation requirements across the system, across all 208 school facilities, as well as other buildings. We've spent almost $6 million for salaries for employees who performed functions related to the COVID-19 pandemic. We will need to continue to procure personal protective equipment throughout the year, and as we move into any sort of in-person or hybrid learning. We also know that any sort of hybrid learning is going to cost a great deal of money to both provide a virtual platform for those families who need it, as well as an in-person platform as we move back into in-person school. We've focused our CARES money that we've received on technology, connectivity, tutoring, as well as professional learning for adults, and other requirements around the spaces that will be used when we return to schools with students. We also know that we have a major issue around telehealth and nursing staff. Our nurses, for example, come from our county health department, and we have been working hard to stand up telehealth to meet the needs of our students who are not in school buildings now, but need health, have health concerns or need health support. And that's going to grow in our need as we look across the rest of this year. There's going to be a tremendous number of bus routes that we'll run. And so it's very hard to estimate exactly how much all of this will cost as all of this evolves. But we know that it's going to be very expensive to provide all the levels of service and to meet all the needs that we must meet. And so funding is just going to be of critical importance as we move forward throughout the rest of this year. And I'll stop there and turn it over to one of my colleagues.
Thank you, Jack. I am Monica Goldson. I am the CEO for Prince George's County Public Schools. And we're doing much of the same things that Montgomery County is doing. We too, as we're all required by the State Board of Education, we have to go back to our boards with our recommended data-free entry at the beginning part of November. So we will all be doing that. And we too will be entering back second semester, providing parents the option of continuing with virtual learning or doing a hybrid learning 2 days a week, where half of our population comes on Monday and Tuesday. The other half comes on Thursday, Friday, and those days that they're not physically present, they will continue with virtual learning. Our teachers, our buildings are open on Monday and Wednesdays, and we have around 2,000 teachers out of our 10,000 that currently report to the school on those Monday and Wednesdays to teach from their classroom. It is optional. We have approximately 27% of our employees that are back in buildings on Monday and Wednesday. In Prince George's County, we are still at phase 2. A modified version of phase 2, but still at phase 2. And so that we still continue to monitor the number of people we have in our building. We too, when we have a COVID-19 case, end up doing full building closures. We post those on our main website, and we probably have a building closure 1 per day, minimum of 1 per day, based on the number of cases that we have. In terms of safety precautions and materials, we purchase the same materials that Jack Smith mentioned: gloves, hand sanitizer, masks, gowns, face shields. We do that same thing. But obviously we've known that there will be a need for additional items as we're moving through that we might not have thought of. with the use of the CARES Act funds. So of course, as we started creating those budgets back in June, things obviously are ever evolving and change often. And now we've had to make purchases for a higher grade air filters for all of our schools. And those are a lot more expensive, and are investigating air purifiers, which for a school system that has 206 schools, one per building, I can't even fathom how we could potentially pay for that, or if they could make air purifiers as fast as they could make ventilators. So we too are researching that component, and I'm grateful that my colleagues are shaking their head because we have these kind of conversations every week. The other area that we also, when we bring our students back, that we're focused on is really the creation of the 6-foot rule, 6-foot social distancing, and the challenges that it brings for our secondary students. We're able to meet that in the cohort model at elementary. But many times we're going to have to explore some non-traditional ways to feed our students. And so the cost for that, though we're beginning that planning stage, we may have to make some purchases of some additional mobile carts for our food service workers to use on different levels of the building, so students can just leave the classroom, go to that hallway, get the meal, and bring it back to the classroom. And when we were beginning the process of creating our budget for CARES Act, I have to be honest, at least for Prince George's County, we had not thought that we would need those items. And so we'll have to go back to our school board to begin to reallocate funds for that. Around challenges, and I'll speak to this one only because we've discussed this amongst all of the superintendents that we do have, and it really is around enrollment. For all of us, we had a decrease in enrollment at kindergarten, and it's not a new phenomenon for Maryland. It actually exists across the United States, but that reduction in enrollment at that K level could potentially affect our funds for next year if we're looking at the September 30th enrollment to determine our per pupil expenditure amount. Immunization. Our current rules around immunization require that our students have to have immunizations or updated immunizations in order to receive the delivery of instruction. And while we're all in this virtual experience and we understand the importance of immunization, we are pushing it from all of our jurisdictions every day. We are looking for a little bit of leniency to allow our students to still learn virtually while they are acquiring their shots and getting their immunizations up to date. And we're hoping that we'll get support in saying that students have to have it updated by the time we're saying that they must return in a hybrid model. But we could not fathom telling a kid that they couldn't come on screen because they don't have their immunizations. And so that is one area. And then the other area is really around closing the digital divide. We all quickly had to find a way to get all of our students online. We thought on March 13th that we'd be closed for 2 weeks. Little did any of us know we'd be looking at, I don't know, I feel like Groundhog's Day, month 6 or 7. And so we quickly went to our boards of education and found ways to support our communities. And I can tell you, I'm grateful for the support of our Board of Education, who immediately allocated $2 million for us to pay for Wi-Fi for our families and to purchase hotspots. But honestly, we're at a point where we all should be having a conversation around closing the digital divide, and broadband Wi-Fi access should just be like heat, electricity, and water. There is no way that we can function. I think we have an example of that today where a school district completely had to shut down because of a fiber optic issue where a line was cut. And that's no different if it were a workplace, the whole work facility probably was shut down for the day. And so we really need to have conversations around closing that digital divide. And then lastly, really quickly, just, to talk about how we work to begin to close the achievement gap. I think it is the piece that keeps all of us up at night every day. And we are utilizing so many of our nonprofits in our community to help to bridge that gap. As Dr. Smith shared, he's using funds for tutoring. We're doing that virtually so that we can provide that one-on-one support to students during school hours and after. Dr. Smith has found a way to do it during school, and we found a way to do it after with many of our nonprofits and our churches, because at the end of the day, our teachers are actually giving 200%. And so to turn around and then ask them to tutor in the evening, I'm grateful that community has helped us with that. But through our CARES Act fund, we were districts that were able to offer summer school for free. And for me, I have 40,000 students who participated in summer school and 1,000 students who actually took courses for accelerated learning. And so because of that, we do want to continue that option even when we're out of this. And so while COVID has presented itself with so many issues that we had to quickly address, I always say to my staff, let's write down what works so that when we do go back in person, we can replicate those areas and continue with them. So I'm sure my other colleagues will probably hit on some things I might not have, but I wanted to make sure they had enough time. So thank you.
Thank you, Monica and Jack. And I will leave time for Sean as well as we proceed in order. Again, thank you for having us all today. And many of the same themes, I think, cut across our school districts, even though the context might be clearly a bit different. So within Baltimore City, we have, like most of the state, we began virtually the school year. And since this summer, we have been increasingly bringing more small groups of students back for in-person learning opportunities. So over the summer, we successfully offered in-person learning opportunities for about 200 summer school students in person, in addition to thousands more online. Then in the fall, late in September, we opened 15 student learning centers. We even had some of our delegation, Baltimore City delegation, who were out yesterday visiting some of those student learning centers in person as a way of providing in-person assistance for families who actually don't have the option of working virtually from home, but who need to be out working. And so we were able to partner with our city recreation and parks. And so those 15 sites have had increased participation over the course. We have some that actually have waiting lists, and really want to thank our city partners for their work with us on that. We announced last week that the majority of our students will remain virtual through the remainder of this semester, but we will also offer in-person opportunities to groups of prioritized students at approximately 25 schools, really building on the work that we've been doing since the summer. And families will continue to have an option, strictly voluntary, of whether or not they want to participate in visiting a number of our sites. What we have seen is that virtual learning is not working for everyone. And so we feel that it was very important to expand, like many of my colleagues, those in-person opportunities across all schools as we approach the second semester. But for second quarter in November, we will be announcing Friday or Monday, those 25 schools that will be having small groups of students back in school. So for example, some of our English language learners, our homeless students have taken great advantage of some of the early opportunities. Some of our students with disabilities, we heard from families, they needed additional support. And the bottom line was, how do we provide safe environments for young people, for staff to be able to return. And really happy to say that we have learned a great deal since the summer. We have standard operating procedures that have been put in place. A shout out not only to all of our health commissioners. I don't think that there's a district leader on this call who could do what we do without close collaboration with our health commissioners. In Baltimore City, we also have a medical, a health advisory committee comprised of health professionals and epidemiologists from Johns Hopkins, Morgan State University, as well as the University of Maryland Medical System. So they have fed very directly into our precautions. And again, a number of those are the same that you heard from Superintendent Smith and CEO Goldson, really working through what does it actually look like to have social distancing in a classroom? What does it mean to have full PPE for staff? That keeps staff safe and young people safe. And then we have also made additional investments in our custodial staff. We had ratios prior to the pandemic that were frankly too low. And so we had to go back in, do a lot of the reprioritization, reinvestment in additional custodial teams that helped really make sure that our buildings were sanitized, that they were being kind of regularly cleaned according to what we know from the CDC and others needs to be in place. And then, like a number of my colleagues already spoke to, the prioritization of our CARES dollars, not only on healthy and safe school building settings, but also in technology. I smiled when CEO Goldson referred to the cost of air purifiers. I will tell you, each one of ours cost $800 per air purifier. And we've prioritized those, particularly, as everyone knows, because we have large numbers of buildings still in Baltimore City without high quality HVAC. And when we consulted with our health advisory, they said to us way back in the summer, you know, Dr. S, you're going to need to have in some of these rooms, because of the air filtration systems, that extra protection. So when we talk about cost, we have to incorporate everything that is needed for that. I will just say our estimates in early August, when we did a count of all of the costs associated with COVID, from technology to PPE to air filtration systems. And our estimation at that time was that we had spent close to $131 million in total in additional costs through our federal, state, and local additional revenues that really tried to step up. That was great in that it was approximately $77 million, but it still left us with another $16 million that we had to reappropriate. And again, I'm just giving the numbers because I think it's important, and you're hearing from my colleagues, we all talk about what needs to be done, but it is important to understand there is a cost to keeping kids safe. There is a cost to keeping staff safe. There is a cost to bridging the digital divide that still is in place. You have district leaders here who could have said, is it really a school system's job to provide connectivity? But what you're seeing are leaders who did not say that. We did what needed to be done. But again, there's a cost to that. Nobody's giving out free Wi-Fi the last time I checked. And believe me, I check frequently. And then finally, what I would say with regards to some of the places that we could still benefit from additional coordination, really would be about decisions with regards to assessments and how we are moving forward with assessments in ways that support learning and the tracking of learning loss, not necessarily for punitive purposes, given that we are all, frankly, navigating new territory that is scary for all of us. And so to add that weight, we think needs to be serious discussion. And then finally, I will end with saying that additional assistance with regards to contact tracing, testing. I know many on this call may be familiar with what just came out about New York City, and that testing plan that I think you referenced, Senator Pinsky, Chairman Pinsky, that requires a coordinated approach to testing. It should not be that in Baltimore City, we're negotiating with the University of Maryland and Johns Hopkins to see how we can get our staff tested and not realize that Montgomery County and Prince George's, right, and Superintendent Bolson are also still they have a testing need as well. So the patchwork approach to things like contact tracing and testing really is making it even more challenging to return. And as we think of areas to build up, I would just highlight those. So I'm going to stop because I see the clock, and I want to make sure that my colleague, Superintendent Bolson, also has a chance to share. Thank you.
Okay, thank you. Finally, Superintendent Bolson. You need to unmute.
Muted.
You need to unmute.
I had to be the first one to do that, right? My others are so much better. Thank you all so much, Senator Pinsky, Senator Kagan, for inviting us to today. And also I want to say hi to my local senator who's been a great partner in our planning, Senator Gallion. Hartford has a slightly different story from the others you've heard from today. We opened the school year with learning support centers. We had about 1,800 students in our schools on September 8th. And 41 of our 54 schools had some students. And those students attended 5 days a week. They were learning virtually, but they were in school, and they had mostly support staff in front of them. Then on October 12th, all of our teachers returned to our schools, and the students who were in those learning support centers transitioned into their teachers' rooms. So now we have the situation where our teachers are teaching those who are in front of them from the learning support centers, and but also teaching their students who are virtual. Our focus in those learning support centers was to make sure we had a place for people who needed internet. Like many parts of the state, we have many families without access to broadband or internet, but also students of essential employees, and then others based on need were who we had in the learning centers. And again, they're coming 5 days a week. And we thought it was important to sustain that even as we began our hybrid. Our hybrid started this Monday. You heard from Senator Gallion. He has students coming. Kindergarten, first and second grade are coming for a 1 day a week hybrid. Our neediest special education students are coming in 5 days a week. Some of our English language learners, and then some of our CTE students who are coming in for more hands-on stuff have started this past Monday. And then in 2 weeks, we will bring back grades 3 through 5 and pre-K for 1 day a week. And then we'll bring our first secondary students into the 1 day a week hybrid beginning on November 16th. And then from there, we'll have to assess if we can move to more days a week. 2 days a week is what we have in our plan, but we are finding that sustaining the 6 feet of social distancing has been challenging even with the 1 day a week hybrid. So we have learned a great deal from that. Our safety is really based around the 6 feet of social distancing. That keeps our group sizes around 10. And since we have some students coming 5 days a week, the students who are coming 1 day a week, when you add to that, we get to that 10 pretty quickly. We did work like the others to really see how to maximize our HVAC systems, but we didn't look at considering replacing those, just thinking the cost was going to be so prohibitive. But more recently, the conversations about air filtration and stuff are things that we would like to engage in, and that really should be a state level conversation. We've also done a great deal to train staff and parents. We have a magnificent site with parent training videos from our Parent Academy. So we found that's been a really good way to push information out to our families. With regard to funds, on some level, we've been fortunate this year. Things aligned for us. We have very good support locally from our county in our operating budget, and as well, recently they've talked to us about covering some of our costs with their remaining CARES funds. So we've been fortunate at the county level, but we do know looking into the next few years, we have some great concerns about sustaining this as we worry about revenue in other places. But then also if we're really thinking about some of those bigger picture items like the air filtration and that type of thing. I was going to take a minute and talk about the plans we have in place when outbreaks occur. Since we've had students in our schools since the first day, we've been practicing, we've been following the Maryland Department of Health clinical decision tree, but we had to do a lot of work with our local health department to be clear on exactly what some of these steps mean for us and how we do the contact tracing, the quarantining, and the isolation. And we've been isolating students and staff members every day since school started. We've been fortunate not to have a positive student case, but we know that's a matter of time. And we've had a number of staff. Originally, it was more in the support staff area, and then lately we've had a couple of teachers. And that takes us to the bigger question about what do we do with outbreaks? Because the challenge of outbreaks is we do have a definition that has come down from the health department, one for classroom and cohort outbreaks, and then also for school outbreaks. And those are defined in the language for classroom and cohort. It talks about 2 or more laboratory confirmed cases in either a class or an outbreak who are epidemiologically linked. And that's been important because, you know, since this is a community transmitted illness, it's hard to know, but with the contact tracing, we can have some sense of where people may have acquired the illness. And then school outbreak, the definition we have is 3 or more classrooms or cohorts with cases from separate households that meet the classroom cohort outbreak definition. So while we have the definition of outbreak, what we don't have is a great deal of clarity about what to do if there is an outbreak. You know, do we close the classroom, and for how long? Do we close the school, and for how long? And those are questions that are constantly coming up. Again, like my colleagues have indicated, we've had great relationship with our local health department. So we talk through this with them, but that does mean that to some degree, there's some variance from district to district based on that collaboration with the local health department. So those are some of the greater challenges. And so I will just I'll close with our instructional, how we plan to address some of the learning loss. I mean, we know that particularly some students have struggled much more than others. We invested much more this past summer, as others did, with summer programs. Our summer programs were all virtual, but we had over 4,000 students at different levels coming in to do the work. I think, you know, looking forward now to this next summer, if we're able to invest heavily in the summer, that's where I think we can have the greatest gains in terms of being able to target the students who need it the most. So the fact that I can be planning, I know who's struggling now. We're you know, between our teachers and our administrators and our student support professionals, we have a really good sense of who needs the targeting. And so our work now is to make sure we have the resources set aside to do really robust summer work with a really strong lens toward equity based on those who we know needed the most coming out of this year. So I'll end my comments there. I know there's probably going to be plenty of room for questions. So again, just thank you for the opportunity to speak.
First, I want to thank all of you for taking the time to join us. I know you've got a lot of pressing matters back in your own districts and in your schools and with your staff and students. And obviously you've raised a lot of questions. So with that, committee, if you have questions, please go to let's start with Senator Fry Hester from Western Howard County. Can we
in Carroll County. Thank you so much, Mr. Chairman. So 2 weeks ago, I sent a letter to MSDE and the State Department of Education, the board, and following a lot of research that I had done talking to folks in my districts. And wanted to follow up with two things because they actually responded to me last night. But first of all, I'd really like to see the state be a more active partner with the local superintendents. And one of the questions I asked was the state's, how the state was helping them out in terms of PPE, air filtration, testing, and the like. And I'm just pulling up their letter here. They mentioned the $400 million in the CARES Act. They mentioned the $10 million grant. But they also say, to date, no local school system has cited PPE as an obstacle to reopening school buildings. So there seems to be some miscommunication because I think there's a lot that is an obstacle to opening that the $10 million isn't going to cover. And so my question is, have you guys communicated directly to MSDE their, the cost that you've just articulated to us about what it's going to take to open? And have you gotten a response?
I can start with that question. We have talked not so much in numbers, but in needs. Like you're talking about, we have suggested that some statewide procedures around purchasing of PPEs, air filtration systems, those sorts of things would be effective, as well as statewide procedures around areas that have cost. But as my colleague said, Dr. Santalese, that we need to do things in a uniform and consistent way in testing, in contact tracing, in all of the outbreaks, as Dr. Bolson said. All of those things need to be much more consistent. And then where we need flexibility, we need to be able to say that and talk about that. And we have had multiple conversations with the state about all of those issues.
Yeah, it seems like they're abdicating some of their responsibility. The second question, I asked them about providing detailed metrics for school openings and closing, much like the consistency that you all have just asked for. And they cited back to the July 23rd response to laboratory confirmed case of COVID-19. And they also cited the update on August 27th. I think that what I hear you asking for is actually more specificity in terms of what to do, if there is a case. And I can see for myself, representing more than one county, that parents are going to want similarities between, what's happening in Howard County versus what's happening in Carroll County. So I would just let us know how the state can help, because I feel like there's some miscommunication with the state MSD, the Department of Education.
I do want to add there that we have had in our recent conversation that there will be a creation of a dashboard from Maryland State Department of Education that we will see probably toward the end of, I guess, this month when they present it at a board meeting. So we'll be able to provide some additional feedback once we've seen what that looks like.
Excellent.
Senator Washington. Okay.
Am I unmuted? Great. Thank you all so much. Thank you, Dr. Bolson. Thank you, Dr. Golson, my own CEO. Thank you so much. And of course, Superintendent Smith. We, as you heard from my colleague, we are very sympathetic, and we very, very, very much want to be a support to all of you. And we know that you're having a very difficult time. It is interesting that we have, half of you are saying that you're starting in the second semester, and then 2 counties are starting sort of in person earlier. I just had a general question around, I guess, why. We understand that there are some problems with in-person learning, but why are the most vulnerable students being called in first? I guess that's the first question. Then I had a follow-up.
Yeah, let me start first. I wanted to make sure I alluded to where we were in Prince George's County, and that's still at stage 2.
Right.
And so like my colleague Sean, he's not. His district is not. His county is not. And so because of those components, I think that's why we're all at different places.
Right.
Each county yields something different. For Prince George's County, I do post on our website what our COVID-19 numbers are, which I get from our health department every day.
Right.
And as you know, there is now an increase, which interestingly enough, the medical practitioners who sat on our reopening group anticipated would happen around this winter time. But we do continue to converse, and we do have a plan moving forward when we get to stage 3. But we have got to get to that next level, and we keep getting stuck with the number of COVID-19 cases.
Right. So, but do you have, Dr. Golson, do you have students, because part of, I guess, in my own school district, and I think some of the other ones, that this tension of that we have students that are struggling with virtual learning. So the justification is, I'm just, your district is making a different choice. And believe me, I'm towards the more cautious. So just so that you should understand where this question is coming from.
And I
why are you choosing to?
Yeah, let me be very clear. I never want to give the impression that we don't have students struggling. We have students who are high achievers, to ELL, to special education, to our average student. We also have students who are excelling. I think every day I get emails from students. And honestly, every time I get those emails, it really is to connect them with a person in their school, either their mental health practitioner, because I am blessed to be able to have 90 schools that have mental health practitioners. So have someone contact them, a professional school counselor, or even just the teacher who is reassuring them that it's going to be okay. It's difficult. Every day I think about our English language learners and our special education parents. And it's also why we created parent centers that are open Monday and Wednesdays in the morning and the evening, mainly for our English language learner family. So we could have people there to assist with translators to help them navigate. But I too agree with you, where we are is that health and safety is paramount. And as I share on our website every day, we close a building every day.
Yeah.
And we are prepared come February with some better direction around closing classrooms versus whole schools, because we do need to reinvestigate how we're doing that closure piece now. But it is difficult. I never want to paint that it's not.
Yeah, I appreciate that, but I also appreciate that you're focused on fixing the issues instead of simply, doing the in-person learning. So thank you. Thank you, Chairman.
Thank you. Senator Ellis, please.
Thank you, Mr. Chairman, and thank you for your leadership on all these issues. I also want to thank the superintendents for sharing with us some of your heroic actions during this difficult times and also your challenges. I had a discussion yesterday with our school superintendent here in Charles County, Dr. Kim Hill, and one of her main concerns was the decrease in enrollment. In Charles County, we have like a number she gave me was, 751 students, fewer than last year, this time enrolled. And that's around close to 5% of our student census. Of course, it affects the funding. And could you share a little bit more? I think Dr. Smith touched on this briefly. Could you share more if you have a number or percentage? And is it, my question is, what are your numbers? What's the impact of it? And what do you see are possible solutions to that funding decrease?
Sure, that's a critically important question to us. And I know that Monica spoke briefly about this earlier too in the discussion. Right now, as of today, Montgomery County has 3,700 fewer kindergarten through 12th graders than we had last year. And that's going to have a really significant impact on our maintenance of effort in terms of what that looks like, as well as our state funding. And that's happening across all 24 systems to some degree. As far as I know, and I welcome my colleagues interjecting if you know differently, I think every system has experienced decreases in enrollment in the state of Maryland. And so we're looking for some way to smooth that out from the General Assembly and those formulas to think about that, because what we think will very likely happen is that as the pandemic recedes, those students will come back. And so, if they come back not right before September 30th at some point, either they come back this spring, we'll get a lot of students back, but they won't be counted in this year's count, or we get a lot back next fall at various points. Whatever it is, it can really, really complicate and negatively affect the way students are counted in the state of Maryland. And so finding some way to legislatively smooth out that in those enrollment issues is going to be of critical importance. And then as my colleague also mentioned, the whole issue with immunizations and students not being counted because they're not immunized. And we know that while they're on a virtual platform, we absolutely must serve them, and we're committed to making sure they get the immunizations before they return to a physical school building. But those are going to be critically important issues this year around school funding and the way that we're able to serve our students.
I would also just add, Senator, that I have flagged for members of our own delegation that there are emerging legislative pathways to this, as Dr. Smith referenced, that we can see in other states. So we have, for example, we know already that the state of Florida has already charted a legislative path. We know that the state of North Carolina has already charted a legislative path. So I would just kind of reinforce that this is not something, frankly, that needs to be reinvented, that we see steps forward and models for that.
Okay. Thank you. Senator Lamb, followed by Senator Bailey.
Thank you, Chairman Pinsky, and appreciate all the participants' attendance in this. I had a question, two brief questions. One that dovetails on what Dr. Goldson had mentioned as well, because I've heard concerns coming out of Howard County, and I cover both Howard and Baltimore counties, where there is concern about enrollment being down and how that could really affect dollars and the allocation of future dollars to the local school systems. Has there been any guidance or information forthcoming from MSDE about decisions and how this may be redetermined, given the fact that the pandemic is probably skewing attendance downward? Any guidance to any of you? Because I don't think MSDE is on.
No, as of this point, we have not received. We have discussed this with the state superintendent. She's very concerned about it, but it's likely going to require some sort of legislative fix.
Okay, thank you. Second question touches on, if and when we have a vaccine for COVID, have any of the school systems begun discussions on what the policy might be for a potential COVID vaccine, and whether or not the districts have any role in ensuring that their students are vaccinated or not, or any guidance or discussions that have begun at MSDE, bringing the local school systems into place as well. Anything that you can shine a light on those?
Sure. Having worked at MSDE for 3 years, I was very involved with the local school systems around immunizations, and that would require a change at the state level. That's another one of those places where statewide standard procedure will be necessary. And the decisions around, who gets the vaccine, if it's in limited supply, if you must take it to return to school, as many of these vaccination conversations are going right now, as well as we're having conversations. I see Dr. Travis Gales is on here, who's been fantastic in Montgomery County as a partner and an advisor and a helper around the actual administration of immunizations and how schools will have to be engaged in that for such a large vaccination program as will be required once it's available. So all of these things have been discussed, but once again, we're looking to the state for direction and standardization on these things.
So just to be clear, you're looking for state guidance on this to provide support in how these decisions and policies are rolled out. Have you been engaged in any discussions so far with MSD? Because, in the best case scenario, we could have some vaccines starting to roll out in, a few months. And it obviously takes some time to, come up with these types of plans and prepare for that.
There have been discussions. There have not been initial plans shared with us, but we absolutely agree with you, Senator Lamb, that we need to be talking about these things right now in terms of the state position on the availability and what the circumstances is. For example, our school district employees, essential employees, that's a question we've asked. And what's going to happen when immunizations are available? Because the immunization program in the state of Maryland is a Maryland state program. It's not a local school program.
Have your school systems been involved in these discussions? Have you been asked to be involved?
No, the superintendents
No.
have just brought them up as points of concern and anxiety so far. Is that a fair assessment, Monica and Sonia?
Great assessment, and no, we have not been involved in those conversations.
Okay. All right, thank you.
Senator Bailey. Let's unmute him, please. Senator Bailey, can you unmute? Great, please.
Okay. Thank you so much. I have just a couple of questions. When we talk about, it's my understanding when we talk about school reopening plans, that this falls directly under the responsibility of the superintendents. But I've heard different people say, well, in coordination with the boards of education and the local boards, and this is what they said, but I cannot find that anywhere in COMAR. everything from Comar and Maryland education law says it's directly the responsibility of superintendents for their reopening plans. And I was just curious if you had any information other than that.
Well, the requirement would be that the Board of Education would have to, endorse or approve any plan that you took forward. The superintendents, when you think about the opening of school, we traditionally think about it around inclement weather. And that's where that comes from, and closing for snow purposes, short-term closures. In this particular situation, clearly no one's ever been in this circumstance. And so we lean heavily on our local health departments for advice and for the metrics. And then we work closely with our boards of education to make determinations about how to proceed. And so the way the law has been interpreted historically is not the circumstance we're in now.
And I think that you'll also see some variation in terms of what each board decided to weigh in on, right? So in Baltimore City, our board voted on the extension of the delay in the opening of the school year, and we presented the plan. I keep my board updated. In other jurisdictions, you would see an actual numerical vote on different aspects of the plan. So I think that variability you probably would experience between school districts.
Yeah, I was going to add the same thing. The Board of Education oversees the school calendar. They have that authority over the calendar. And when the state released their definition of attendance, then we all adapted our administrative procedures in alignment and then are working within those confines.
This is a question that we've confronted as well, whether to have the board approve all elements of the plan or just generally provide sort of support for it. And because normally the school boards operate more at the policy level and the administration is more at the operations. But the degree to which the board comes together to direct the school system to do things, there is some space for them to have a little more say in this. So really, it's been more what you heard from my other colleagues is we work with our boards to get a sense of where they are, to get them to support. But I think we found that because this is such a unique circumstance, there's not a clear line to answer for this.
Senator Bailey, another question?
Yes. And thank you very much for that. Now, being that I represent, like many senators, multiple jurisdictions, for those counties who have pushed to a second semester reopening, because I've got one county that all the teachers are back in school. I've got the Sale and Compass students are back in, very similar to what's going on in Harford County, but in Calvert, we're not there yet. So I was just curious to see what the timeline for providing reopening plans to the students, parents, and the families, as far as the fact that, I get calls from parents even in other jurisdictions that are close to mine, and it seems like that this closed school situation has been there and been in place for months. And sometimes I hear that we're still working on formulating a back to school virtual plan, which we've been doing for a couple months.
Well, let me start for Prince George's County. I think everyone's plans out for the year are outlined in our reopening guides, which all of us are required to post on our own web pages, which also were evaluated by Maryland State Department of Education. And so at least for Prince George's County, I made the announcement on July 15th. I informed our parents before Maryland State Department of Education required that we make an announcement again in November, that we go back and reassess where we are the first week of November. I committed to our community that they would begin making their choices of whether they wanted to continue with virtual or hybrid for the second semester, and that would happen from December 1st to the 15th. And then we would be, and based on them sharing, they would know what would happen the beginning of second semester. Those dates have not changed. The only thing that has been added in is the going back to make sure we talk to our boards of education at the end of first quarter, which the Maryland State Department of Education is now requiring of all of us to do.
Right, and I would just add also, Senator, that the timelines for how we communicate with families might vary by school district. So I had already promised Baltimore City families that they would know by the 16th of October what we would be doing in accordance with our plan by that date, right? But as CEO Goldson referenced, our plan has been posted since August on the website, reviewed by MSDE. I think the local decision-making that you're hearing now reflects something that Superintendent Smith referenced, and that is the flexibility. So in Baltimore City, our thrust was really, we heard from our parents, particularly of some of our most vulnerable students, that they wanted an option. They wanted the option to be able to return. So, and we had successfully, without large outbreaks, we had done some in person. So we built on that. Had that not been the case, we might have taken a different path. And so I think the combination of communicating some definitives within the plans that we were required to have posted, combined with some of the internal deadlines that, as CEO Goldson said, for her community, she knew where they were, and so she went out earlier. So I think that's the relationship with the variation. But I know everybody in Baltimore City was waiting for October 16th because I had said October 16th, and so I had to make sure that I announced. If I had been someplace different, that date might have been different.
Thank you. Thank you.
Thank you.
Let me ask you a couple quick questions. I want to go back to something Senator Hester said at the very beginning, and I think Superintendent Bolson responded to, and that is about the clarity on closing when there are outbreaks. It's my understanding definitions were given of what an outbreak is, but not what procedures should be followed. You know, New York City's been talked about. They have 1,700 schools. We have 1,400. They have 1.1 million students. We have 890,000. Not only are they putting a testing regimen in place for staff and students, they have a protocol for what to do with outbreaks. And so I guess I find the silence deafening coming from the state, from the governor, from the Department of Health, from the state superintendent, that there's not a clear procedure across this. Health is health. And as Senator Fry Hester mentioned, if you're in Howard County and Anne Arundel's right next door and you're going back sooner or closing a school sooner than another school, parents are going to ask, are you not protecting my children? And that there's not a health-based, science-based protocol for what to do in case of a procedure, I find abominable. And I don't know what you four superintendents are doing with that. And if there's any way, and I think this has been discussed for many months, of having a more cohesive approach coming from the state. And I don't know if you're throwing up your hands or you're just going to try to do the best you can. I know we're going to hear from a health officer from Montgomery County. They're also employees of the state. And I know some are hesitant to set a policy when the state doesn't have a policy. So let me ask that question first, and I have one second question.
We would certainly appreciate a standard procedure for standard definition on outbreaks and a standard procedure for what happens when that definition is met. I think that
We just had that conversation this past Friday, around really truly what defines an outbreak. Is it really more than one? Is it more than one in that same school, in that same classroom? It could be that you have two people in a school that weren't even close contact, don't even know each other, so we just need very clear directions on that. And we did just have this conversation with the state superintendent on Friday. So I'm sure that that information will be carried back. But this is where consistency is important.
Did she promise to get a resolution and a standard procedure and protocol in place?
She did say she would take it back for sure.
She'd take it back?
Yeah.
Okay. Hopefully we get a solution, because I don't think any of us want to put you in the precarious situation of closing or not closing, whether it's one student or 3 students, and whether you close a classroom or you close a school, and doing it either prematurely or too late. Where,
and I think the other thing, Chairman, is again, the consistency. In Baltimore City, we do have a procedure. It's part of our standard operating procedures. We developed it. The challenge is what you said before, right? Is it going to be different in Prince George's as it is from Montgomery? And what does that communicate to the public? So we are developing protocols because we need the protocols, right? I mean, we opened up summer school for 200 students, and it would have been irresponsible not to have a standard operating procedure for how to handle that. The challenge is when we're trying to communicate broadly across the state what that looks like. So I think to your point, it's the consistency that families can rely on. We're doing what we need to do. And we came up with one based on our partners at Hopkins and University of Maryland, who clearly, and Morgan, who know this area, but it would be so much more helpful and require so much less kind of individual efforts if we could rely on consistency across the state.
and it's not an existential question, because Caroline County had to close the school. So this is not something we should wait on 2, 4, or 6 weeks from now, because many of you are starting to bring students back. Let me ask you a second question. We understand getting through the school year and getting through this month and getting students back is a challenge. Mitigating this problem and closing the gap is not going to be done in the next 4 or 6 months. I took some notes, and so far I've heard extending tutoring and also utilizing more expansive summer school are 2 of the proposals I believe I heard from the 4 of you. I guess I'd like to hear if there are any others over the next beyond 6 months, because some students I believe are going to lose as much as a year and a half of schooling. I think even our brighter students, if you use any kind of standards-based learning, even in some of the more wealthier upper middle class communities, I think they're going to lose up to a half a year of learning. So if we have many students losing between a half a year and a year and a half of learning, we're not going to make it up overnight. And we go back in January, we have to do the override on Kerwin, the blueprint. But I think we're going to be looking for guidance from you in what other steps, more immediate, maybe midterm, after these 6 or 8 months, the next 8 or 12 months, what can we do to rapidly try to close the gap and make up for this pandemic, which obviously was beyond our control in this call.
Senator Pinsky, one of the things that we've been working on already, and we would invite this and really benefit from it as one school system in the state, and I think the whole state would benefit from it, is if the state would go back and work with all 24 systems to rework the state report card and look at using different analytics and other ways of thinking about showing progress, because we had no state tests last year. This next year we'll have a new state test that none of us have seen, and that it will be piloted at best case in the spring. And so to have a state report card that's entirely dependent on a state test that doesn't exist at this point, and I'm not being harsh, we don't have data from that. And so we're looking in several states around the country, they're looking at using multiple measures that are in place in school systems to bring those together and really get a sense of where students were, where they are now, and then predictive analytics to look forward about where they can be. And we have begun these conversations in Montgomery County and would be eager to work with the state and the rest of our partners to look at this.
So then if I can just summarize, doing another look at assessment and tracking the learning loss, because that's going to be with us a while, and in lieu of standardized tests that are already required by law. And that's another area. Do I have that right?
Yep.
Okay.
Oh, they're not in lieu of, because right now they don't exist. There are no results from last year, and next spring's results will be initial.
Yeah. I wanted to just add to what Jack said. For us, we did do a diagnostic with our students, 160,000 assessments done online, and that does help. But really, we do need to look at the state testing structure, And there need to be more assessments done at the teacher level so that we can begin to close that gap with them. The second part, I wanted to also bring up that we did set aside funds in our CARES Act to extend the school day when students return. But let me be clear, when we created that, we really did think that we'd be back way before now. And so clearly now that extended time probably will have to be used so teachers can plan effectively for this dual teaching role that we find ourselves in, where they are teaching students virtually and in person. And so we also have to be cognizant, as much as I wanted that extended today would be with students, it really now might have to be with just the teacher to provide them that ample time to plan accordingly.
Great. Let's go to the last question for the superintendent panel. Senator Simon-Ayer will have the last question, then we'll go to the health and safety panel. Senator Simon-Ayer.
Thank you, Chairman. And thank you for the guests who presented today. Appreciate that. I just wanted to share one thing. A lot of my constituents are really frustrated, and I'm sure you are as well, as during this pandemic. Not only are the parents suffering with two people trying to work, you have the kids, and you have higher levels of anxiety, depression, even suicide. And so, you know, there is a cost to keeping them out of school as well. And I hope you realize that. But going back to the one question about the statewide closure protocol and things like that, I've been down the legislature for several terms, and I know that the locals appreciate their local authority. And that is a very strongly presented during the session, that they want to keep their local authority. And as far as having a statewide policy with that, say Garrett County versus say Prince George's County, things could be different. So my question to you is, do you really want a statewide criteria where one size fits all, and it may not be what you had in your plan, and it may be different, and you may think that's too easy or too strict, and you don't want that flexibility? So is that what you're asking for?
No, we're not asking for a blanket set of decisions. We're asking that we look at each of these issues and say, is it more effective? Is it more efficient? Is it better cost? Is it safer if we have a statewide plan or if we have local autonomy? And each one will have to be examined individually, each area of this work, because we range from 2,000 students to 160,000 students. We range from very urban to very rural. And so there's no way that you could just have a statewide plan, but there are places we could have statewide procedures like immunizations and vaccinations where we already have a whole system that we could be planning right now as a state. And I could go on, but the answer to your question is no. I don't think any of us are asking for a blanket statewide plan on everything.
Let me just follow up with one other question. As you are probably aware, we're going to have some budget challenges this year. It's going to happen. We had the Kerwin plan, it got vetoed. There's a plan to override it potentially. Would you be willing to divert some of that money from the Kerwin plan into the money you're asking for the lower enrollment? Would that be a solution that would work with you?
I would personally have to see a lot of analysis of all of that to understand or be able to answer that question.
And I'm going to speak for Prince George's without seeing it and knowing the details. My hesitancy is around really, as I shared before, we have 90 schools that have mental health providers. We really were counting on the funds from the Kerwin legislation to help to expand that for those mental health supports. And I have 206 schools. So I am only touching less than half of the kids who need that support. While I do know we are one of those districts that had an increase of 5,000 students that I had to figure out how to accommodate without the funds. So I firsthand know what's gonna happen if we're not able to stop the hemorrhaging around the enrollment issue and trying to find a solution legislative wise.
Okay. Thank you very much.
Let me thank all the four superintendents. Let them get back to other challenges and tasks they have. Dr. Golson, Dr. Sanalise, Dr. Smith, Dr. Bolson, thank you for your expertise. We'll probably be calling on you some more. Thank you.
Thank you.
Back
Thank
to your other
you.
work.
Thank you all.
Thank you all.
We're going to move to health and safety. We have Dr. Travis Gales, the health director for Montgomery County. And we also are pleased to have David Lever, formerly head of the IAC for the state of Maryland. overseeing school facilities, and prior to that, worked in Prince George's County as director of school facilities. So we have asked them to talk about making buildings safe and making the return safe for students. So I believe, Dr. Gales, are you starting off?
I'd be happy to do so.
Great.
Okay.
Welcome.
Well, good afternoon, Committee Chairman Penske, Vice Chairman Kagan, and other senators. Thank you for the opportunity to be with you all. Thank you for your continued efforts and support throughout this pandemic and predating the pandemic to ensure that the children of Maryland have access to great, high-quality education. And this has taken on added significance as we continue to move forward with a pandemic that we have never seen before, that we don't have a well-written playbook by, because none of us have experienced this before, in spite of the fact that everyone in some capacity appears to be an expert on the subject. So thank you for the opportunity to speak with you all today. And I do want to say a special thank you to the superintendents who spoke before, including my home superintendent, Dr. Smith. They are in an unenviable position in terms of having to balance health with getting kids back to school. I am a pediatrician by training, so I know firsthand from practicing for years and seeing the value of in-person learning. One of my favorite times of year would be doing preschool physicals and talking with young people about their excitement about going back to school and what they hope to get out of learning and what they hope to be when they grow up. But I also recognize, again, as a medical provider and a public health official, the value of ensuring that that can be done safely in an environment that minimizes potential transmission. And I see a very happy baby there that makes me excited, Senator Simon Ayer. We like very happy babies. But ensuring that they can be safe in that process. And so I use that as a starting point of the conversation, and I'll keep my comments brief to allow for questions. Now, many of you, it sounds like, have already discussed and are aware of the different guidelines and parameters that have been set and put forward for school reopenings. The state released some guidelines late August, and the CDC about 2 weeks later came out with their own federal level guidelines in terms of what are the criteria for schools to reopen. Now, part of the challenges that you've discussed about differences with jurisdictions within Maryland have also been experienced on a national level, because there are different standards across different states and jurisdictions in terms of what are the safe parameters to reopen. One of the universal criteria, however, is the fact that any reopening strategy and criteria is dependent upon demonstrated low rates of transmission within community transmission within different jurisdictions. The reason why that principle is important is because if you see lower rates of community transmission, you are ensuring, or as best as you can, that an individual walking into a school or a business, wherever they're going, whether it's a student, a staff member, or a teacher or administrator, you're decreasing the likelihood that they're going to walk into that school setting and space, bringing COVID into that space, which could potentially increase the risk of others to come into contact and enhance the risk of transmission. So any safety guidelines must be built upon the premise of having demonstrated lower rates of community transmission to decrease the likelihood of an individual coming to that space. And hence, the guidelines from the state as well as the CDC are premised on rates of test positivity, as well as rates of cases per 100,000 or over a particular time period. Now, the state guidelines have used a test positivity below 5%, as well as markers of cases per 100,000 on a daily basis of below 5, between 5 and 15, and greater than 15. There is some variation in the CDC guidelines. Their categories are a little bit more restrictive in terms of breaking the categories into 5 groups that talk about very low risk of transmission, low risk of transmission, moderate risk of transmission, high risk of transmission, or very high risk of transmission. And those data points and baselines are a little bit different than the state. For example, test positivity starts at below 3%, between 3 and 5, 5 to 7, 7 to 10, and greater than 10. And the cases per 100,000 are spread out over a full week period as opposed to a daily average. Now, again, in spite of those differences, they're all contingent upon looking at the rates of community transmission before a student, staff, or teacher walk into the school setting. Now, we've been able to gather a significant amount of information to some degree with schools that have reopened across the country. Some of the continued themes in terms of best practices, and it sounds like you all were discussing this prior to this panel, is the notion of having a testing component. So how do you integrate testing or make testing available for students, staff, teachers, and others? Again, so that you can identify cases early before they potentially enter into the school setting and again introduce COVID, which would potentially mitigate further or potentially enhance transmission through different networks. So another piece that again was discussed that I wanted to bring up in the previous conversation with the superintendent is the notion of contact tracing. Contact tracing is a fundamental core function of public health. It's interesting as a public health practitioner to hear everyone talking about it now in the COVID setting when this is something that we do on a regular basis across a host of different conditions, communicable, reportable diseases. Now, there are some nuances in terms of how you conduct the process and in terms of the guidance that you provide. For example, while our public schools have not gone back into session here in Montgomery County, we have had a number of non-public schools reopen in different capacities from some level of a hybrid in-person to a mix of in-person and virtual instruction. Now, since early August, when the first set of schools started going back, we have completed 132 contact investigations regarding non-public schools, and we have approximately 40 ongoing investigations right now involving COVID confirmed cases or COVID-like illnesses. Now, in each of those situations, each school is by law required to report COVID confirmed illnesses as well as COVID-like illnesses to the local health department. Now, when that happens, our disease control team will meet with the staff and also look at the COVID-link database to match up cases and interview if they are a resident of Montgomery County, complete a contact investigation interview where they assess the individual's history and also assess others in the school setting to determine who is considered a high-risk contact and who may be at risk of exposure. Now, based upon those individual interviews and those specific circumstances, further guidance is provided to determine if there is a distinction between a classroom needing to be closed, a portion of the school needing to be closed, or the entire school needing to be closed. Now, in our experience in those different investigations that I've mentioned, I would say approximately half of those involved an actual COVID confirmed case, and the other half involved COVID-like illnesses. And again, it's important to distinguish because COVID-like illnesses, by virtue of the guidelines and criteria set forth by the state in their letter in late August, says for the purposes of this guidance, COVID-like illness is defined as one, any one of the following: cough, shortness of breath, difficulty breathing, or new onset of loss of taste or smell, or at least two of the following: a fever of 100.4 or higher, chills or shaking chills, muscle aches, headaches, sore throat, nausea or vomiting, diarrhea, fatigue, or congestion and or runny nose. And so any illness that presents that way is also reported to the health department. And until there is a test result that confirms that that case is not COVID, the guidance is the same in terms of potential quarantining of students, staff, and other members, or closures until that lab result is obtained to rule out COVID as the diagnosis. So as a part to that larger question that was introduced around how contact tracing is done, this is the type of guidance that we have provided to our non-public schools, and we would follow those similar protocols in terms of working with our public school system if and when a case popped up to determine the level of closures or the level of quarantining and isolation involved if there were cases to pop up.
Dr. Gales, we're gonna have to wrap it up. We have another speaker on this panel, and we have
all right, I will stop there. That was actually my last note, and happy to answer any questions.
Okay, we'll go to David Lever, and then we'll come back for questions. So stick around, Dr. Gales. Mr. Lever.
Senator Pinsky, members of the committee, thank you very much for this opportunity to speak about the work that our group has done over the last several months. Ronald Skiles of Prince George's County Public Schools in April called together a group of about 30 engineers, architects, school facility planners, subject matter experts. Mr. Skiles is on the call and can provide information with the Q&A. We were looking at guidelines for school design and operations, both during COVID and post-COVID. We developed a document that was published in June through ASBO called A Clearinghouse of Resources to Aid in Reopening Schools. The basis for research was the MSDE scenarios that were developed in the Maryland Together Plan. And we also looked at research that had been done by the CDC, the World Health Organization, ASHRAE, the Chan School of Public Health at Harvard, and the work of other states, Missouri, and especially the state of Tennessee. And the members of the committee or the collaborative rather are continuing to assess the guidelines in relationship to what's actually happening in schools now. And out of this, and the discussions that we've been having recently with school officials, we identified the need for data, for guidance, and for metrics. And I'll come back to each of those points. And I think, like the members of the committee and the superintendents, we feel a good deal of urgency about the situation, concern about students who are going to lose a period of personal development and academic growth that is really irretrievable if it's lost for any extended period of time. So in terms of data, what we need to know is what works and what doesn't work. That's been said before in this conversation today. So what kind of staffing is needed, what resources are needed, and of course, the funding to support those. We also need to know what are the impacts on operations, teachers, and educational achievement of different measures that are taken. At the moment, there is no repository of statewide information that local officials can turn to for information. Unlike, as we understand in Tennessee, something like a statewide communication process has been established. And very clearly, all facility planners, all maintenance people are working under an atmosphere of very constrained resources. And so they need to know what's most effective, what can be done most effectively and efficiently in terms of reopening strategies, from HVAC to cleansing to personal behavior and so on. And of course, the cost data is essential because we need to know how much to request. We've been hearing the discussion about funding, and it's very open-ended right now. We don't even have a real sense of what's been spent statewide so far by all the school systems. So on the handout I gave you, there are listed a number of categories that could be investigated. Mechanical systems especially, we're all very aware, talking to the engineers, of the importance of good air quality in this situation, of ventilation, space planning, cleaning and disinfection, operational issues having to do with, say, arrival, dismissal, the use of entrances, transportation, of course, how buses are cleansed, how they're used, the loading of buses, potential hazards that haven't been talked about too much, for instance, toilets and water fountains, and updates of information. And our dilemma here, of course, is we know the school officials are tremendously overburdened as it is right now, and asking them for a great deal of data is just going to be about impossible, frankly. It's too much for them. And at the same time, we can't miss the opportunity to actually retrieve data that will be useful to us. The second category is guidance, and this simply echoes what's already been said. We've heard this plea again and again, the need for guidance that's uniform, consistent, and documented. And without that, we'll have uncertainty, confusion in the public, and varying responses among school systems. And I have provided an example. I won't go into that because it just echoes what's been done. Tennessee's guidance, by the way, and we only know this by way of conversation at this point, is much more precise than the guidance that Maryland has provided. And we also believe, and again, looking at how Tennessee is handling their situation, that uniform guidelines do not mean a constraint on local prerogatives to be able to adapt the measures to local conditions. And finally, on metrics, we really don't know what success means in the situation. We don't know how to measure success. There are a number of ways. Is it the percentage of students who are receiving face-to-face education? The number of teachers who express confidence that it's safe to return, the percentage of parents who are willing to send their children to school, Is it by indicators of academic retention and advancement? Or is it simply by sustaining the process? And without this kind of notion of are we winning or are we not winning, in some way to make adjustments along the way, decisions are most likely to revert to a simple open and close, a binary decision, a kind of panic response, frankly, to cases of COVID. So it was refreshing to hear that there are guidelines that are being offered that are more precise. And so we're looking to collaborate and to work with the committee and other groups in the hope that we can address these issues of the lack of data, the lack of uniform and consistent guidance, and the lack of metrics. And just to reinforce the message, there was an op-ed piece in the Washington Post on October 15th, written by 4 instructors at the Chan School at Harvard that echo this same thing. And I'll just quote at the end, it says, "It is clear that evidence-based policy is not driving school decisions at this time." So I think there's a kind of a warning out there that this is an extremely urgent issue. And we can't come to you right now and say the school systems need X dollars, but we can come to you and say that there is a need for the guidance, the data, and the metrics. So thank you very much.
David. Thank you. Before I go to Senator Hester with the first question, I have 2 short ones, one for Dr. Gales and a second one for both you and David Lever. Dr. Gales, it came up earlier about flexibility in terms of putting policies and procedures in place. I understand on the front end of different jurisdictions coming back at different times, a Hartford County versus a Prince George's, or a Garrett County versus a Baltimore City, whatever. But I want to talk about the back end. If X numbers of children are sick or have tested positive, or staff members have tested positive, I mean, does geography matter? In other words, I'm trying to understand, is it science-based or do we need flexibility? As I mentioned, New York City has chosen, and I don't know if it's right or wrong, 2 different outbreaks in 2 different classes calls for certain action within the isolation, closing the classroom or the school. Do we need flexibility on a health and science-based issue? Do we know where we're going when Montgomery County does have 3 or 5 or 8 outbreaks among schools like Caroline County had in 8 staff members in 1 school? So I want to understand what you think would be the best strategy to deal with the back end. Because look, we know this is a trial and error. There are going to be outbreaks. Hopefully we're going to lessen it over time as we get control of this and the practices in the schools. And we don't want our children to be canaries in a coal mine. That being said, we heard from superintendents, they would like some direction at the back end of how to proceed. So if I'm a parent in Anne Arundel or Prince George's or Dorchester, I can expect certain things. So that's my first question. And then my second question to both of you, after Dr. Gales answers that, is a question of transparency. The Baltimore Sun ran an article last week saying they were not going to release the numbers of outbreaks in the schools and the number of students. While I understand HIPAA, if you release there are five students were ill in a school or 8 students were ill in a school, that seems to obviate the HIPAA concern. And as Dr. Lever said earlier, we need more information. The schools that have outbreaks might tell us something, and the schools that don't have outbreaks might actually tell us something in terms of their practices. So that's my second question, is the issue of transparency. Dr. Gales.
Well, the first question in terms of flexibility and coming up with universal standards, you're right. There are some areas where there's objective scientific data and criteria, for example, similar to the guidelines that were released to say, here's the metrics, regardless of geography. If you hit these points, we would recommend full in-person versus hybrid in-person versus, complete closure and staying in a virtual standpoint. that would be helpful in terms of trying to come up with metrics to determine if we have to close things. Now, at the same time, in the absence of that, each jurisdiction is working hard to try as best as we can to come up with that language and come up with those guidelines to help inform our educational teams, whether they're non-public or public schools. The challenge is that, again, if there are, in the absence of state guidance related to those things, it can create some differences if our strategies in Montgomery County guidelines are a little different from Frederick, or a little different from Charles, or a little different from Baltimore City. And that is where there can be room for subjectivity and interpretation injected into that process. I think anyone on this call knows that there have been instances where local jurisdictions have made good faith efforts to provide guidance related to education in schools where there has not been state guidance. And when we've attempted to do so, that has caused a cascade of other things that have influenced that process. So I think it's a very precarious balance, but I do think there are some areas consistent with the language that the superintendents use where it would be good to have some universal standardized guidance to help influence those processes that would help to, again, ensure that there is kind of uniform application of those principles. So for example, even where there may be an absence of state guidance, we do work, for example, the health officers do work with each other to say, hey, here's what we're thinking of doing in our jurisdiction. How does this look, particularly in our partners across our common regions, where we know that we share borders and boundaries with folks coming back and forth, whether they're working, playing, going to school, to try as best as we can to make it uniform so that it alleviates confusion for residents. And they also understand why we're being, it's an effort to be transparent and, again, use evidence-based practices to drive those particular guidelines and decisions. And as it relates to, I guess, to segue to your second question, in terms of outbreaks, we have followed the guidance of the state, and we have provided, when asked, or, for example, when there have been situations and circumstances where we have had to inform the public related to a potential large-scale exposure, we have been forthcoming about that information. There are times, I will say this from the privacy perspective, there are some times where you do have investigations where if you do put out specific information related to numbers or the date of a particular exposure, you can potentially identify an individual. Now, that said, so we make every effort to protect privacy, but we also make sure that if there is potential exposure, large-scale exposure, we do make that information public as needed. And certainly any individuals who are at risk of exposure due to coming into contact with an index case, we certainly would make sure that they have access to that information so that they can make the necessary choices to keep themselves safe and monitor their health.
Mr. Lee, you want to add anything on the transparency issue?
Yes, we have had that discussion in our group, and we've heard it cut both ways, frankly. There is obviously the legal issues having to do with HIPAA, but also, as one facility planner put it, he wouldn't want to create unnecessary panic in the public over something that may, in fact, be a minor issue. And that's the danger of putting out the information. But on the other hand, it's very clear that parents would want to know. I've had school-age children, and if something serious is happening at the school where they were, I would certainly have wanted to know. And the possibility of holding back that information could lead to all kinds of accusations later on that there was an effort to kind of, create a smokescreen to divert attention rather than being open with the community. So my own personal feeling is that it's better to err in the direction of transparency, but with the right kind of messaging about if there was a case, if there was an outbreak, how extensive was it, how was it taken care of? That kind of information is important. Also, going back to the issue about protocols regarding this particular issue of transparency, there is a good deal of merit in having the requirements for a certain protocol come from the unified authority of the state, so that you don't have the school systems having to point fingers at one another, parents saying, but they do it that way over there. They're more transparent next door. They're less transparent here. What are you people hiding? All of that. If it comes down as a state requirement, then officials can simply say, this is what the state is requiring, and we have to be compliant. But of course, the protocols themselves should be based on evidence. They should be based on good practice, and there needs to be, I think, a very robust discussion about that, including with locals who will raise the negatives that might be associated with it so that they can be addressed in advance. That's kind of
David, let me go to a question by Senator Hester, followed by Senator Washington.
Thank you, Mr. Chairman. My questions are parallel, actually, yours do. My first is about transparency, and my second is about contract tracing. I have two kids, both who are school age. And as a parent, in order for me to feel safe with them returning to school, I need to feel like I'm getting good information. And so I have a couple questions about the legal issue with HIPAA. The first is that if we've gotten past that for nursing homes, why are schools any different? And the second is, my understanding is that New York has a dashboard that allows community members to view data broken down by public schools, charter schools, private schools, higher education, and state universities. And so if New York can do it, and we can do it in Maryland for nursing homes, why couldn't we do that for schools? That's my first question. My second question is about the contact tracing and testing. And while I generally side on the version of local control, it seems like contact tracing and testing would be, having a national strategy would be my first choice, but having a state strategy is second. And so wouldn't it make sense for the state to have a common contract tracing and testing that goes across all the school systems? And wouldn't that save money in the long run?
I can take a crack at each question. So for your question related to the construction of a dashboard and a database, I think that would be best directed to MDH for them to answer in terms of putting that together. I would say contact the State Department of Health because they would be the ones to put that into place. And as it relates to contact tracing, so the state does have a shared platform. They created COVID Link to have a shared database for cases that come in and to assist the local jurisdictions in completing the contact tracing process. Some of the counties utilize the state platform as the primary source to do the initial investigation or the initial attempt to contact folks, and other jurisdictions are the secondary where they will, So some of the primary counties would start the process and have the state back them up, and the secondary counties would have the state do the initial contact, and if they're not successful, they would do the follow-up as well as the follow-up with the contacts that are identified within that. And so separate from that, building upon that, each jurisdiction has their own apparatus in terms of handling the school-related cases. Again, I can say our public schools aren't in session, but with our non-public schools, we do have several staff members. It's a growing number as more cases come in and more COVID-like cases are reported, that is dedicated to providing that contact tracing and follow-up specifically for school settings. But that's what we do on a local level. There is, again, you'd have to contact the state officials on constructing that at a state level for a uniform platform.
Anything to add to that, Dr. Leverett?
Well, we do see that on a statewide basis, but when I'm thinking about Garrett County, where the economy is actually much more closely linked to Pittsburgh and to Morgantown, West Virginia, than it is really even to some cities as close as Hagerstown or Frederick, it needs to be cross-state contact tracing as well.
Okay. Let's go to Senator Washington.
Right, thank you. And this is actually my questions are in a similar vein. Thank you, Chairman. So I guess but first I want to thank Dr. Lever and Dr. Gales for reminding us again that science matters and that it's important to make decisions based on data and not politics. or even theory. So to that, has the school board met with the individual? So we know there hasn't, have you met individually with our school board? Have they sought your counsel or the counsel of your colleagues, Dr. Gales, about how we should be managing this at all?
So the health officers have not had a meeting with the school superintendent. That level of meetings would occur between the superintendent, their staff, and the senior staff at MDH, such as the deputy secretary and the secretary. I think that to get an official accounting of how MSDE has reached out and engaged MDH, you would have to ask them directly. But I am not aware of, or have not been a part of any one-on-one discussions with any of the representatives from the State Department of Education. That said, I'm in constant communication and contact with our local superintendent and have met and presented to our local board a number of times in terms of providing guidance and guidelines to help them be able to move forward.
So not as a group. And you each individually have dashboards that offer citywide. And of course, I'm interested in Baltimore City, but more broadly, there are dashboards that most of the health departments have. And is this data, are we able to disaggregate the data by neighborhood, race, gender, and income? Is that possible? And why I ask, just so that, you know, it has to do with being able to provide our local school systems, if we're going to make these decisions, to allow them to make more granular decisions. And if there is a barrier, what are the barriers to disaggregating the data? So it's like, can you do it? And in the circumstances that you're aware of, your colleagues, I don't have the Baltimore City Health Department or the other ones, but what are some of the barriers they find?
Yeah, so I'm pretty sure every jurisdiction has some type of COVID-related dashboard that breaks down a host of common measures as well as specific measures that to get to the conversation related to nuances, there are some differences within jurisdictions. And so each jurisdiction, there's some kind of global measures that all of us are looking at, test positivity, cases per 100,000, that kind of stuff. But there may be some that are more germane to that local jurisdiction that I'm pulled out. So I'm pretty sure everyone has one of those set up. And I know for us in Montgomery County, we do look very closely at cases within particular zip codes to get a sense of where there needs to be enhanced testing, enhanced linkage to social support services, and also particularly when it relates to going back to school, we want to have an understanding from an equity perspective of that if we do open schools up and do have to close particular schools due to increases in cases, we also have an understanding of what impact that might have on other aspects of learning and achievement gap and those kinds of things. Now, from a state level, our colleagues, the epidemiology staff at MDH, have done a great job over the months of the pandemic in terms of refining the data process and helping get us that information. And then on a local level, we've been working hard to pull it apart even further to ask a lot of the questions that you've proposed in your comments.
And then
Senator Washington, let me just
I'll follow up.
let me just remind folks, the health officers are state employees and work under the state Secretary of Health. And some are very careful of not crossing a line with the secretary. And it's only speculation whether the Secretary of Health is being included and to what degree in some of the decisions coming from the administration. We can only speculate. Hopefully, science, as you said, is driving this, but we're not in those rooms, so we don't know whose voice is being heard and how clearly. Last question will go to Senator Simon Ayer. If we can make them quick, I see Senator Lamb has signed on as well. We have one more panel to go. Before I have Senator Simon Ayer, I think people know by now that he is the new minority leader for the Maryland Senate for the Republican Party. So our congratulations, I guess congratulations go to you and all the headaches that come with it. Senator Simon Ayer.
I'm still the same senator I always was, but thank you. So you gave me a little clue there. I should filibuster so Senator Lamb can't get his question in. No, seriously, I have two brief questions. One is, I heard you both mention the word guidance, and I'm trying to figure out what that means. Is that a suggestion or is that a mandate that the locals have to follow? And then the second question is with health and science. I'll just share a local thing that happened in Anne Arundel County. It came out that the county sports was banned from participating this year. And they said it was based on science. And then 24 hours later, they came back out after they had people protested it. And they said, okay, we're going to have county sports. So clearly wasn't all about the science. And I was curious, have you seen this in other states? How, I know it may be hard, but to try to get the politics out of it and actually get it driven by science. So those are the two questions.
Could I respond to the issue about guidance? It is recommendations. It's not mandated. The question is, are these what might be called bright line guidance, or are they vague? And I think the example that's been brought up about the MSDE guidance from August 27th, which says if positivity rate is less than 5% and new cases rate is between 5 and 15%, it provides 3 options. Expanded in-person programs, hybrid or partially in-person programs, or limited in-person programs. Well, that's a pretty broad range, between 5% and 15%. And that's where there could be a lot of variation from one school system to the adjacent school system, which provides a good deal of confusion, lack of certainty, and this whole issue about fear, actually, among the, say, parents about whether their own school system is being as careful as the adjacent school system. Why are there differences here? And we have heard the plea for bright line definitions and guidance. So it's still up to the school system to make the decisions, but at least there's a kind of a common parameter out there that says at, let's say, 7%, you ought to be doing this. Now, we do understand that Tennessee has something like that. We're trying to get that information from them. I think it would be very helpful to see how another state does this. It might not have application here, or it might, but I think there's some lessons to be learned in that. So I think that, you know, the flexibility is preserved because these are recommendations. Throughout the document that we produced back in June, we used the word suggestions rather than even recommendations. And coming then from an authority with jurisdiction, they could be recommendations as guidance. The issue about the health and science, we know that we read about new discoveries about this every day. And I think the science has to be changing, but I think that we still have to put our confidence in science as being the best guideline that we have. For the decisions that have to be made. Let's go to Senator Lamb for a very limited question so we can get to the final panel and not go too far beyond 3 or 3:15.
Thank you, Mr. Chairman. Just a very brief question to both of them. And I think this is to draw the line from why reopening and just general reopening policies actually influence and matter to the ability for us to safely reopen our schools. You know, I think from a public health standpoint, Dr. Gales had mentioned that we need to make sure that we have low positivity rates and also low number of cases per 100,000. But the more that you open restaurants, other large gatherings, places of worship, movie theaters, the more that you're drawing down the bank of available cushion that you have to not hit that 5% positivity rate or a high case rate per 100,000, right? And so there is a direct linkage here between reopening things in the general public, whether it's businesses, other locations, gatherings, et cetera, and your ability to actually safely open schools. The more you reopen these other locations, the less so you have the flexibility, the cushion, the ability to open schools. Is that correct, to both of you?
Well, I think you've introduced an important point is, again, it's all about lowering community transmission and thinking very critically and carefully about minimizing those types of activities that would potentially compromise that by, as you said, increasing risk of exposure and increasing potential numbers. And these are tough decisions. And this gets to the second point, and I'll make this very brief. There are instances where we are able to put in mandates in terms of what businesses need to do or what types of things are open based upon the numbers from a public health perspective. As it relates to schools, due to the governor's executive order, we don't have those provisions, and we are allowed to provide guidance to help inform the school boards in making those determinations. So to that question of why there is a difference between guidance in some situations and mandates in others, that explains that. And the science, as you mentioned, in terms of politics, I think those in public health have been very clear about putting forward that scientific guidance and data. And a situation like this, in terms of recommending that there be some limits in terms of how quickly we move forward with reopening certain things, because that could have consequential impact, as you mentioned, Senator Lamb, in terms of being able to open up other things that are based upon test positivity and cases per 100,000, because those numbers would potentially continue to increase, which would make it more difficult to feel comfortable and confident to safely reopen our schools.
Great. Thank you for connecting those dots for us. Thank you, Mr. Chairman.
We're going to move to the next panel. Thank you, Dr. Lever. Thank you, Dr. Gales, for your information. We're going to move on to the other stakeholders. We have representatives from MSEA, from AFT Baltimore, or AFT Maryland, as well as a parent representative. So let's start with MSEA President Cheryl Bost. Welcome, Ms. Bost.
Thank you, Chairman Pinsky, Vice Chair Kagan, and members of the committee. It's an honor to be with you and to listen to the discussion. I want to preface it with, I don't see our presentation and checklist linked to this meeting materials. We have sent it out to you as a committee, but if others need the materials, we're happy to provide them. As you've talked throughout this, we're in the middle of a pandemic. And cases are on the rise in many places, and there's a lot of responsibility being placed on our educators, our parents, and their families. And as colder temperatures and the flu season come upon us, it's going to create other materials. So I do have a slide presentation, if that could be put up. As you know, Maryland State Education Association represents over 75,000 educators across the state. And I thank Dr. Goldson for recognizing that they're working at 200% right now, trying to get everything accomplished for our students. We have some of our districts that have a greater in-person learning that's happening, and others that are still very much virtual. We still haven't gotten the virtual right, but I'll talk about that later. But if maybe we don't have the PowerPoint presentation. So
we're working on it. Keep going, Cheryl. We're just going to have to.
Okay.
On board, we'll bring it up to the screen.
Okay, great. So the first thing is, we have worked with our partners with the PTA and BTU, and we have crafted a health and safety checklist that we are handing out to every educator and asking for every building to go through and fill out the checklist to see that our schools are truly healthy and safety for return. Now, this isn't a wish list of MSEA, BTU, and the PTA. This is actually grounded in the recommendations and mandates that are coming from the Maryland Health Department, the CDC, OSHA, and the Maryland State Department of Education. Over 90% of the items are actually right from their documents. The other few items are just ways on how to communicate that we see as educators that needs to take place. So you have a copy of that checklist, and we will, again, have it out. We want parents to use it, everything, because our priority remains the same. In order to come back, it has to be a healthy and safe environment. And so your first question referenced, are your members prepared to return to school buildings under what safe circumstances and conditions? These checklists outline the health and safety conditions that are needed to come back into our buildings. And you heard the superintendents talk about the cost to do such things. With the purifiers, there's still no plan, as you heard, for testing and have even rapid testing when cases are reported. So many people are waiting long periods of time still for those tests. So this checklist is critically important to returning. It's broken up into areas of building, classroom, and many mitigation items. As Dr. Lamb will tell you, in hospitals, there's a lot of time spent on mitigation so that you can reduce the risk. Another part of the return is a memorandum of understanding that we believe is needed. That's really the trust document. There's been an ever-changing degree. Okay, you can keep going to the first question if you don't mind. There's been a changing directives that keep coming out over and over and over again. But this really, in memorandum of understanding, will help everybody know how we're going to communicate, How are we going to treat these checklists? How are we going to handle leaves? All of this will be spelled out, so there's no lack of communication if you have this memorandum of understanding. We've seen more success in the districts that have already started to have these memorandums of understanding than those that don't have them. Now to the next question that you asked is, what leave policy is appropriate for employees who might be compromised? First and foremost, we believe the checklist and the memorandum of understanding and doing the things proactively will hopefully prevent people testing positive for coronavirus. First, we want a fair consideration of accommodations. Our educators who have comorbidities or are at higher risk have received documentation from their doctors and applied for ADA accommodations with their American Disabilities Act accommodations. A quick example of that is I have a kidney transplant. I am highly compromised. I have comorbidities. My doctor says if I get COVID-19, I will likely die from it because of the different illnesses I have. So many people who've gotten those ADA accommodations work them out with the system, but we have school systems now that are blanketly denying all ADA accommodations. We have one system that approved ADA accommodations and has now blanketly rescinded all of them. Again, a fear, and it creates a lack of trust. On the short term, anybody who has to quarantine and is unable to do their job due to contact and having coronavirus, we believe should be able to have paid administrative leave for school employees. They should not be forced with the threat of unpaid leave or retire or resign if they have to quarantine because they have contracted COVID-19. And then a longer term issue will be create a health presumption to allow for workers to claim workers' compensation to cover the leave as they're being required to come into the buildings. This is a big concern in the minds of everyone, as to especially those with underlying health conditions. The next question you asked is what information regarding outbreaks should be made public by individuals? I listened intently to the conversation about the different dashboards and what is provided in the recent article that says that the health departments won't provide that or the State Department won't facilitate that. Transparency is key. We have to be able to share and track data, protecting privacy, of course. But if we can do this for nursing homes, as Senator Hester pointed out, we need to be able to do these for schools. Right now, we're only hearing of the cases that make the news. Like we heard of Caroline County. We've heard of a case in Baltimore County, St. Mary's County. I can tell you the grapevine of educators tells you have a lot more cases in the schools, even those where teachers and employees are only ones going back and students are not. So it has to be a dashboard, a similar dashboard across the state so we can trust it. And that way we can make family decisions. So if I'm around someone, I hear of it, maybe I won't visit my grandmother to talk to her. So it helps us to make family decisions. So transparency is key. And then there are other priorities. Dr. Goldson talked about the digital, you could change the slide, please. Digital inequities still persist. Many of the devices are still on back order. We still don't have one-to-one. So when we talk about a hybrid, half of that is the digital and it is the virtual learning. And we're not there yet with reliable internet for students, and all of our educators don't have that capability. The bigger issue that's growing is educator workload. I know we hear about the struggle of parents and what they're going through with their jobs. Well, many of our educators are parents and they are teaching and they are trying to take care of their own children. Now we are putting them into a concurrent situation where they are teaching virtually and teaching students in person. So imagine if Chairman Pinsky, you had to run this hearing and you had half of the people in person and half of the people online, and we're trying to run the same type of hearing for both of them. Somebody loses out there. And so it's creating additional workload, it's creating stress, and there is not a pipeline of teachers that are just waiting to come in, and systems cannot find substitutes. So we are creating now a workload emergency. I'm hearing from many of our Eastern Shore and Western Maryland districts who've already gone back into a greater amount of in-person, that teachers are leaving. They're resigning, they're quitting, because they can't do both types of learning. Imagine having 5-year-olds and trying to teach them routines while you have people on computers. And then the funding concerns. I think the superintendent's outlined very well the millions of dollars that are needed that are not there. All of the CARES money has not gone to our public schools. In fact, in the $10 million that was announced in August, more than half of that went to private schools and colleges. Only 33% of that came to our public schools. Superintendent's estimated it's $486 per student that is going to be needed to beef up to the PPE, the virtual and everything. And so far, if everything was allocated across the board from the recent CARES money, that would be $22 per student. So you talk about the social emotional. Finally, just the social emotional impact on our students. There's a great social emotional impact on our educators. So thank you for giving us the opportunity to share this, and I'll open for any questions.
Thank you. Let's go to Denise Riley from AFT Maryland.
Okay, good afternoon, Chair Pinsky and members of the committee. I'm Denise Riley, Director of Policy and Legislative Affairs for the American Federation of Teachers in Maryland. I also have a slideshow, but I don't know if that's, okay, got it. AFT Maryland is a federation of unions who represent educators and staff at the city, county, and state levels. As you can see on this slide, these are 4 of our affiliate unions with members in Baltimore City Public Schools, higher education, state correctional facilities, and the Maryland School for the Deaf. You have our written testimony, but I'll address a few of our issues regarding the reopening of schools. To be clear, teachers and staff want to do in-person instruction if it is safe for students and families. Educators understand virtual learning as a temporary measure to deal with the pandemic is not sustainable, and children must be physically back in the classrooms as soon as possible. But to reopen schools, labor and management need to work together to devise plans to implement, maintain, and sustain a safe environment for students to learn and for everyone to stay healthy. Communication between labor and management is essential to accomplish this. Our members need to be at the table when decisions are made about reopening schools and classes in order to report on what is happening, to continually address issues, and to adjust when necessary. Regular labor management meetings will help to keep staff, students, and parents confident that school administration is listening to concerns and hopefully addressing them on a timely basis. In addition, labor and management need to work together to deal with leave due to COVID-19. Currently, there is still federal aid to temporarily cover employees if they contract the virus, need to stay home due to high risk to themselves or family members, or do not have available daycare for their children. But these funds end December 31st. Problems may arise if workers use vacation, sick leave, or unpaid. Oh, could you go back, please? No, okay. Could use vacation, sick leave, or unpaid family medical leave. They may stay on the job even though sick or testing positive for COVID because they don't have enough leave or can't afford to live without a paycheck. This can cause outbreaks and force schools to reclose. We should not rush to open schools or in classes, especially when not all issues have been addressed and there is little communication between labor and management. AFT has directly seen the consequences of this. Our teachers in the state correctional facilities have been holding in-person classes since August. Although told there would be adequate PPE, cleaning products, and testing, all have fallen between sporadic to non-existent. And although there have been labor management meetings, those in attendance from management have not been given decision-making authority. This has led to outbreaks, causing facilities to shut down, and no contact tracing is done, to the danger of all Marylanders. If we are having these problems at the state level, it feels irresponsible to demand as much or more from less resourced local jurisdictions. It also gives us great concern for Maryland School for the Deaf. Currently, the school's 2 campuses are closed for the fall semester, and all students are doing virtual learning. Our members are not informed of when the school will reopen or a plan to do so. Workers are worried about this, especially since students will be coming from all across the state, and they live on dorms on the campuses. Cooperation and communication between labor and management is just a part of our comprehensive plan to reopen schools. You have the link to the full plan in our written testimony. On this slide are the 5 pillars of the AFT reopening plan that we have shared with our unions and management. Every level of government must have a detailed plan for classes already in session and for those that are reopening. These plans must be developed with workers and unions to ensure proper protocols are established for the health and safety of not just our students and staff, but for all Marylanders. Thank you very much.
Thank you, Denise. Let's go to Crystal Bloomquist, who is from Cecil County. She's the citizens, she serves on Citizens Advisory Panel, and we wanted to hear from at least one parent. You know, the PTA and PTOs across the state, the locals in the state are in a bit of a conflict at the moment. So we did ask Ms. Bloomquist to share some thoughts with us about returning to in-person instruction. Welcome.
Thank you. Thank you so much, Chairman Pinsky. Thank you everyone for everything. My name is Crystal Blomquist. I am a parent representative of the public schools of Cecil County, Maryland. I am honored to be here. I have 4 children of my own, 9th, 8th, 6th, and 4th grade. In addition to that, this fall I helped virtual school 13 students total, so my kitchen table was packed. We've got a diverse crew of learner. The youngest was first grade, and the oldest is 11th grade. Virtual school has been wonderful, and I'm actually happy to leave on a positive note as I'm the last speaker. It has been heavy, and it hasn't been, you know, perfect, but it has been great. And so recently our schools, for several weeks now, we were actually able to open up to all students to come back, all students who wanted to come back for 1 day of hybrid learning. The teachers are doing phenomenal with that, and the students are doing great with it as well. To speak to that, so we, parents had to be comfortable with sending our kids back. So some of the things that we have visited with or were made aware of is some of the safety measures that will be in place, and the schools have been phenomenal in implementing them. So right off the bat, the bus comes, and the bus driver assures us, and we've been made known that the bus is sanitized several times a day and every evening. The children sit in seats with their siblings and are safely social distance from other students. They must wear their masks at all times, and the bus driver assures that, and if they do not have one, they're offered before they even get on the bus. When they get on the bus, they have to have with them a COVID questionnaire to be prepared to hand to the staff as they are getting off the bus. The COVID questionnaire has questions on whether they were feeling well or unwell and what their temperature is. If they arrive at school without the questionnaire, they will be given one when they get there, and their temperature will be taken. They have monitors as they get on and off the bus, making sure they're keeping their 6 feet within the 6 feet distance between each student as they're getting on and off the bus. We have one-way hallways to avoid the crossing. There, in addition to the 6 foot spacing in the line, there's 6 foot spacing at the lunch tables, there's 6 foot spacing in the classroom with the desks and in the gym room. When they do take their mask breaks outside, they are also required 6 foot spacing. And it seems like that would be nearly impossible, but actually they're doing amazingly well with it. Students are super adaptable, and they have picked up, even the youngest kids have picked up on the spacing, and they're excited to be in school, and they know that in order to be there, that the rules must be followed. So you see some little bit of a kickback from, you know, the older kids, even more than the younger kids, but they know that they need to maintain those social distancing measures. There are hand sanitizing stations, and the times teachers are reminded when they should use them. There are sneeze shields around our students at their desks, and the bathrooms are assigned to certain grade levels. Some of our students, some of the schools have one per grade level, and oftentimes they are just using, they're just allowing one student in at a time. There are, let's see, the water fountains are closed. They do have, some schools have water filler stations, but you have to bring your own water bottle. The water fountains are closed. The play sets are closed for the children that are outside, but you would be amazed, and that seems a little harsh, but you would be amazed at how quick the kids pick up and make games that are safe to play, standing in a circle at a 6 feet, at a 6 foot distance. They're just happy to be back with their friends and back having conversation. Singing is limited to outside with the masks on at 6 feet apart, which seems like, oh, that would hardly make our kids, you know, want to join chorus or be in chorus. But my daughter, when she came back from school, she was super excited. She said, Mom, we were together, we were singing, we were outside, and there was only 8 of us, but we had our masks on, and it was really neat. It was the first time they had been together singing since March. So that was incredible. So those are just a few of the safety measures that came in mind. There are so many more behind the scenes. They have bagged breakfast and stuff like that. But when I first was, you know, considering sending my children back, it was, of course, like, is this possible? Is this safe? Is this what's best for them? But you realize pretty quick when they come off the bus after the first day, when there is such excited chatter, that it is what was best for them. And that is most important. They're able to build relationships with the teachers, and they're building them virtually, but even in person, it's such a gift to be able to see your teacher in person and to communicate with your teachers some questions you may have had. I have a nephew who is doing coding, and I wasn't able to help him with the problem. And we were walking through a Blackboard Collaborate, but he and I were both getting frustrated. And all of a sudden the teacher was like, well, I will see you in just a few days. We'll walk through this together. And visibly relieved he was. And he was able to walk through those steps with her on Tuesday. And it was amazing. And the kids are like, we're working with pencil and paper again. It's been phenomenal. And I did speak, I know that the workload for the teachers is extremely heavy right now. And our teachers, we are doing hybrid. So they are including the virtual students and the in-person students, but they are doing it amazingly well. It's really phenomenal. They're including the students in the classroom and on the virtual, where their hands are raising and they're just communicating with each other, even though they're not in the classroom together, and they're able to see their classmates, and it's been phenomenal. The teachers did say that as hard as it is.
Ms. Bloomquist, you're gonna have to wrap it up. We have 4 minutes left for questions. So
okay, as hard as it is, they're happy to have their students back in class, and that's all.
Thank you. It's around 3:17. We will stop by 3:30, if not before. We're going to start with the Vice Chairwoman, Senator Kagan from Montgomery County, and then followed by Senator Gallion. Vice Chairwoman.
Thank you very much, Mr. Chair. Thank you to you and all of EHE's staff and all of the witnesses for the testimony and for this hearing. This is obviously one of the most important issues before the state and for the future of our students and our economy. All of it is interconnected. 2 things. One, Cheryl Boast, thank you for flagging the issue of transparency. I think that parents, staff, faculty, and students must know about if there's an outbreak within a school, and so that information is important. Senator Pinsky has been focused on that. Senator Rosapep, as well as Senator Pinsky, but Senator Rosapep has been focused on that. He has talked to the chairman and to me about it, and I suspect there will be legislation requiring some sort of transparency, because I think we have that right, and everyone deserves that right to know about the status. So thank you for bringing that up. And second, I'm really disappointed that MSDE is not here, but frankly, it is a little bit in keeping with their lack of engagement with us on so many issues. So I toss it to the faculty and parent representatives. And I wonder whether you have brought some of these issues to the Maryland State Department of Education, whether the superintendent or the board has been responsive, and whether you have reasons to be optimistic as to whether some of your concerns will be addressed on the statewide level as has been requested. That we, yes, we are 24 different jurisdictions, but we do need to have some baseline expectation of safety while educating our kids. And I don't know, Cheryl, if you...
I can talk to that because I was originally in the spring part of a stakeholder group that they put together. Not that they listened to many of the recommendations, but we have not met since the summer. So they've reached out to stakeholder groups. I speak each time at their Board of Ed meetings and the public comment, but they're not reaching out. They are not talking to the stakeholders. And recently, even the local superintendents have written a letter to Dr. Salmon asking them to make some decisions on assessments, because we have no idea at the end of the semester how we're going to administer the MCAP in a virtual situation. So no, there's very little communication, responsiveness, or inclusion.
So let me just ask a follow-up, which is if you're not communicating or you're not getting a partnership with the state education, how about the governor's office? Is that too much to hope for?
No, that's not happening. Right now, we're looking at each local association and their relationship with the local school board and the local superintendent. And that's where we've had the most conversation, but nothing statewide.
Really disappointing.
Yeah.
Denise, do you have any different experience?
Oh, I'm sorry. I was just going to say, we have actually had meetings with the federal delegation to intercede on our part because we are not getting responses from anybody. So we have told them we do not have PPE. This is endangering the entire community because people are leaving prisons and things and going to different areas. And yes, we have, and as I said, we've had to go to members of Congress and the Senate and ask them to please ask Governor Hogan to intercede.
Mr. Chairman, I hope that you and the president or this committee can take action and see whether we can get some engagement from the leadership of our state. Thank you.
Thank you. If only.
If only.
Senator Gallion, followed by Senator Ellis.
Thank you, Mr. Chair. Two quick questions. One, Mrs. Bosch, you were talking earlier about the price tag per student to make sure they can go back safely. I think you had it like $48 per student. I was just wondering, what's the breakdown or analysis on that? How did you come up with that number?
So it's not our number. It's $486 per student. The National Local Superintendents Association compiled that data, and the local superintendents here in the state agreed with that amount. You heard the superintendents talking about plexiglass and hand sanitizer stations, and even the parent, all the things that are temperature checks, all that needed to be purchased. So that was a number that came out of the National Superintendents Association and conferred and agreed upon by the local superintendents. $486.
486. Okay, thank you. And the other question on one of your priorities, and I actually spoke with one of my constituents today that had this exact same concern about the educator workloads. And I, for example, I have two young daughters in the public school system who, they're going to school, but the teacher's still doing the virtual plus the in-person at the same time. It's only one day a week starting out now in Hartford, but that definitely is a concern. So I guess this is more of a hope than anything that we go as safely, but as quickly as we can to getting back into in-person. And I believe that would alleviate a lot of these problems. We can get our children back into school. But there was a article that just came out this morning from NPR.com about the reopening of schools. And it cites two international studies that show no consistent relationship between in-person K through 12 schooling and the spread of coronavirus. And there's also a third study from the United States showing no elevated risk to childcare workers who stayed on the job. So as you make recommendations, we always talk about looking at the science. Do you take those kind of studies into account?
We look at those, but we take our guidance from the Maryland Health Department and the CDC, and that's why we put together the checklist. And so, the parent was talking about all the things that were happening when her student went into school. Those are right from the checklist. So if we can have folks follow the health and safety checklist, then we believe we can get faster to in-person learning and also mitigate when there is an outbreak.
Okay, and I appreciate the one of the previous panels also mentioned the importance of local control on a lot of this stuff, because, you know, in Hartford and Cecil counties, the way we're moving might be a little different than some of the more populated areas. So, you know, I really want to stress that as a priority for having that local control. Thank you.
Great. And before I go to Senator Ellis for the last question, you know, people have talked about air exchange and HVAC, air filters. It's been suggested that systems upgrade to what's called MERF 13 or 14. That's not cheap. And some systems won't even take the upgrades. They have to have the purifiers, which Superintendent Santelices said was $800 per purifier. And if we want to take care of the aerosol and the air in the room, that also is a concern. These costs do go up. I mean, that's why that $486 figure is average, including infrastructure for the building, as well as masks and face shields, et cetera. Senator Ellis.
Okay. Thank you, Chairman. I really appreciate this hearing. Just there's such a complicated, multifaceted issues. And I want to echo on a different level, my colleague, Senator Gallion, mentioned following the science. Well, most scientists, medical doctors, Dr. Fauci onward, they talk with Dr. Redfield, they talk about this fall going into winter will be the darkest period in American medical history with coronavirus. They talk about, you know, the increases which we see across the nation now. I think 34 states, as a report I saw yesterday, cases going up. Their projections are coming to fruition right now. And we as a society, we are talking about opening up. We're talking about sending more kids back to school, more teachers back to school. And so it seems like we're listening to more of the politicians than the scientists. And, you know, the thing is, I respect folks in their professions. I'm not an epidemiologist, and so I wouldn't pretend to play one, not even on a Zoom call. But I listen to them and I respect their analytics. And I'm very concerned about our teacher population, our school administrators. They're mainly females. They are in the workforce, they have children. And I believe a lot of scientists really say that children, even though proportionally less likely to have adverse effects from the coronavirus, they can easily transmit it to adults. And so we have that information from the scientists, and we're talking about opening up and getting more kids back to school in November and onwards. And so I'm very concerned when we talk about, and I think Ms. Bolson-Riley, you talked about teacher gets sick, you know, avenues for them to get paid. Because obviously they're in the classroom, more kids in the classroom, the chance of getting this disease greatly increases scientifically. So, and mentioned, I'm concerned about the structure for them to be taken care of. These teachers, like I said, with families, if they get sick. And I'm not sure who mentioned, but someone mentioned workers' compensation. And workers' compensation, in my opinion, experience over the years, has been one of the worst mechanisms for taking care of workers who are going through health issues. It's cumbersome. It goes through a long process of hearings and gamesmanship by the commission and the lawyers. I mean, it's just a very disgusting process when it comes to taking care of our workers. So that's an opinion I share. I don't know if you and the ladies in the union would want to discuss that, and what's your ideal way for teachers who are forced to get back in the school because they need this income. They just can't say, hey, quit. And if they...
Well, let's give them a chance to answer that. Okay. We could. You each have about 40 seconds. We are going to end at 3:30. So I'm going to cut you off, Senator, and
Thank you, Mr. Chairman.
a quick 30 or 40 seconds.
Right, and as we shared, obey the ADA accommodations that people have, provide administrative leave, and even though workers' comp is cumbersome, it's the only option that we have right now. If we can come up with a more creative one, we're open to having those discussions.
Ms. Riley?
Yes, it's right now we would love to have the HEROES Act passed so we can extend the coverage that we have for workers who get sick on the job or cannot work because of pre-existing conditions.
Thank you, the three members of this panel. You know, as schools go back, we're going to have to learn by trial and error, and we have to have data and we have to have transparency to find out who's doing it right, who's running into bumps, and they have to take one step back and one step forward, two steps back. Those schools that are able to take 2 or 3 steps forward with few cases and few outbreaks, we've got to learn from them. So a lot has been raised today. Some of the issues will come back to us in January in front of our committee. We are going to have to take some steps to mitigate this because it's not going to go away. So I want to thank the committee members, all of the panelists, all of the public who's followed this. It is a very challenging issue. It's a very challenging issue. We have to take the politics out of it. We got to get it right because, as Vice Chairwoman said, this is also about the economy. You know, preparing our students to go back to school and effectively learn, and actually to be able to learn more. Part of Kerwin was to even raise the expectations of what they graduate with to fulfill many of the jobs that are out there. So it's all interrelated, and I want to thank everyone for their time and their thoughtfulness in proceeding this. So with that, we'll bring the hearing briefing to a close. Everyone be safe and stay healthy.